heart disease and heart attacks. Coronary artery disease is the number one killer in the United States and in the rest of the Western world. The disease involves hardening of the coronary arteries, the blood vessels that carry oxygen to the heart. When they become blocked by hardened deposits of plaque, the heart muscle is deprived of oxygen, and this results in the death of heart muscle or myocardial infarction, the common medical term for heart attack. A severe heart attack, of course, results in death, usually within a few hours of onset. What are the most common risk factors associated with a heart attack? 1. Obesity. Fat people are more likely to suffer a heart attack than thin people. 2. High blood pressure. I have discussed this serious risk factor at some length in the preceding section. 3. Stress. Psychological stress is considered a significant risk factor in heart disease. Some authorities even profile a particular type of personality called type A that is more prone than normal to coronary artery disease. Type A people, usually men, are aggressive, impatient, tense, and hard driving, forever trying to beat a deadline and unable to allow themselves to relax. Their primary sickness is that of being always in a hurry. Medical researchers have questioned whether there actually exists a clear-cut type A personality, but there is no doubt that hostility or fear or any powerfully enough psychological stress can contribute to heart disease. 4. Increased cholesterol. High levels of cholesterol in the blood or hypocholesterolemia is found more frequently than normal in people with coronary artery disease. Cholesterol is a fatty chemical or lipid that is found in certain foods as well as in our blood. People who eat a lot of cholesterol-rich food, such as eggs and red meat, tend to develop increased cholesterol in their blood. So evidently, this risk is directly related to diet. Research has proved that eating a great deal of rich food in general increases the risk of hardening of the blood vessel. 5. Smoking. Smokers are much more likely to suffer from heart attack and cancer than non-smokers. Take such 3 risk factors: high blood pressure, high blood cholesterol, and smoking. The chances of a heart attack are nearly doubled if any one of them is present in a person's medical profile, quadrupled if 2 are present, and multiplied by 8-fold if all 3 are found. 6. Lack of physical exercise. Heart attacks occur more frequently among inactive people and among those who lead mostly sedentary lives. 7. Other more specific risk factors include genetics. Your risk is higher if there is already a family history of heart attacks, uncontrolled diabetes, and old age. Being born a male has always been a classic risk factor too. But this is slowly changing as women expose themselves to the privilege of a man's world, such as smoking, obesity, inactivity, and type A tensions.